You are all in the right place if you're here to learn about point of care ultrasound and the potential revenue on investment or business case for POCUS. All right, we have, it looks like a few more people joining, and then I'll begin. All right. Well, thank you all so much for being here today and spending 30 minutes together with us. My name is Dr. Tatiana Haverlook. I'm the founder of Hello Sono with the mission of bringing point of care ultrasound to more people so they can benefit from this tool. And today we are focusing on the numbers. I also wanted to introduce you to Pia here. She is supporting the webinar. So if you have any questions that you wanted to ask anonymously, you can actually just message her and we can do a Q&A at the end. I will also ask you all to mute yourselves during the presentation so that everyone can have a good audio experience. All right. And a little bit more about myself. This is actually me doing ultrasound at 14,000 feet. Actually, I think it was 17,000 feet at Everest Base Camp on a glacier in a makeshift tent at Everest. And the point of this picture is really, if I were doing ultrasound out there, that was honestly my only imaging modality. There's no reason that we can't have POCUS in our primary care clinics, in our urgent clinics, or wherever else you are practicing medicine. And POCUS is being done in space. These are my two awesome cats, Hunter and Sage, and I've been a little bit obsessed with pickleball, so I am happy to talk POCUS or also play some pickleball with you when I see you next time. So today's agenda is to learn a little bit who's in the room today for this webinar, and then we'll really discuss what are the potential revenue from POCUS, from direct billing versus what are the cost savings opportunities and potentially cost avoidance for some of you. We'll then talk about the investment that you might need to make to get your POCUS program started. And I'll go over the billing readiness checklist that we have for you. And in the end, we'll have some time for Q&A. And I apologize ahead of time if I speak a little bit too fast. I live in New York City, and I guess that's how we speak. And I have a lot to share with you. All right, so Pia, why don't we share our first poll? And we have two questions for you. One is, who's in the audience? Are you a clinician? Are you an administrator? What kind of practice are you in? Are you practicing in the emergency department or urgent care or primary care? Maybe you're a hospitalist. That's the first question. And the second question is around, are you using POCUS clinically? And if so, are you billing for POCUS? All right, so it looks like we have a bit of a mix, but we have a presentation from primary care, urgent care, and also emergency medicine, and one inpatient provider, and 4 others. And in terms of so far, in terms of billing, so some people are performing but not billing, and some people are not yet using POCUS clinically. So you're in the right place if you are planning or looking into introducing POCUS into your practice. Revenue is an important piece of it to make sure that's financially sustainable. All right, and I think, Pia, did you share the results?
Yes, the results
Okay.
are up. Yes.
Okay, thank you. Appreciate it. And we can stop sharing.
Okay.
All right, so when I think about financial impact of POCUS, there are certain indirect financial impacts, but there is more direct impact where we can actually put numbers to it pretty easily. So one is the direct revenue that you get from billing for POCUS. The POCUS comes with CPT codes. It's a procedure. If you document it appropriately and if you archive your images, you can bill for it. Of course, as long as it's medically indicated and those CPT codes are included in your payer contracts. The second way you can have a financial impact from POCUS is really that cost savings opportunity, right? So it's preventing the ED admissions, or any admissions or ED visits, it's preventing more expensive imaging potentially, or catching diagnoses earlier, so there's less expense on healthcare needs for the patient. And then finally, there's also this cost avoidance possibility, and we'll talk about it a little bit more, but maybe POCUS can be a better solution for certain types of patients that you're seeing, and you can potentially avoid costs by doing other type of imaging or testing in your clinic. And I did mention the indirect um, impact, financial impact, and those are things that are a bit harder to measure, right? But that's, for example, the throughput of patients in your clinic or in your emergency department. There's quite a bit of emergency medicine literature looking at throughput, how POCUS actually expedites throughput for patients with respiratory conditions or renal colic because you can get answers much quicker. There's also kind of more indirect financial impact of patients receiving or perceiving their care to be better, right? So they would be giving you better NPS scores, for example, and that can translate indirectly into numbers. I don't have those exact numbers for you, though, as an example. So I wanted to cover some of the ranges we are seeing of reimbursement for POCUS based on 2026 nationwide CMS physician fees. So these are some examples here for the commonly used diagnostic ultrasounds, so ranging from abdominal aorta to a fast exam. And that range covers anywhere for long ultrasound, for example, it comes in at around $60 based on the CMS nationwide reimbursement. And that's a global payment, right? So it includes professional and technical component. And this ranges to up to $180, $200 for the fast exam. And obviously, depending on your payer mix, and if you do have a lot of private payers that you are using, those numbers might look higher for you. This is more to give you an idea of what's possible. And here we're including also the technical component because this is mostly speaking to outpatient clinics or urgent cares. If you are part of a hospitalist group, say, or an emergency medicine group where you are able to separately bill the professional component, you would only be looking at the professional fee. So, and usually the professional fee is a third to a quarter of the whole global payment. And these are some examples for the procedural ultrasound. So this is the reimbursement in addition to the actual procedure, right? So you would be billing for the foreign body removal, plus you would be billing for the ultrasound guidance, additional $64, for example, in this case. I hope it gives you a bit of an idea. I wanted kind of, oh, these are the CPT codes that we actually have available for you to download if you want to check your own payer contracts. So we'll drop a link in the messages so you can check those out, and those are free to download. There's two versions for primary care and for urgent care. So I wanted to zoom out a little bit and look at one clinic doing point of care ultrasound and what does that translate financially to. So say your clinic is doing 10 POCUS exams per week, which is a pretty conservative number. I would say the more you get to know POCUS and different applications for POCUS, the more utility you find in it. The more patients you'd want to get focused on because you are getting extra data to make a more informed decision on your patients. So, but using this 10 focus exams per week, you have an opportunity to bill for $30,000 to $90,000 annually, and that's using those physician fees from CMS. And if this is an advanced practice provider who is performing those, typically it's 85% of the physician fees. So that translates to $25,000 to $76,000 annually. And that is assuming that you're a fee for service type of clinic and that the CPT codes are part of your private payer contract and you're able to bill for each scan you're performing out of those 10. Obviously, your situation might be different. So if you are more in a mixed contract situation where you have some flat fees and some direct, some flat fees, and some of the direct payment models, then these numbers would vary. And I do want to invite you to kind of play around with the POCUS ROI calculators that we have on our website. There's two of them there. There's the first one that's geared more towards outpatient clinics, where it will ask you for the volume of exams you're anticipating to perform and the type of exams, and it will give you a number based on those CMS fees for a billable amount on a monthly and annual basis. The second ROI calculator, it only uses the professional component, and it's really geared towards physician groups working inside the hospital, so would only be billing that professional component. And this is kind of what you would get in an email form once you fill out the results. It will email you kind of your input, what you put in, and then it will give you the total monthly return on investment and a total annual return on investment. And we'll share that also in the follow-up email. So I think this is, if you're still trying to figure out if POCUS financially makes sense for your practice, your institution, this is a good place to start. And then after that, you can use the CPT codes that we have provided to actually check your private payer contracts to see what are the agreed upon fees you have with your payers, other CPT codes, even part of your contracts. I'm going to now switch gears a little bit and talk about cost savings opportunities. So this is especially important if you're a big healthcare system, also if you're a primary care practice that's in more capitated type of plans and or value-based care, where your goal is to actually decrease the overall healthcare costs. And that's actually how you get paid more, is by decreasing the costs. So just to give you a little bit of a perspective, there's not exact numbers here, but this is what the literature shows, that preventing one CHF admission is a cost savings of around $16,000. Preventing one pneumonia admission, 1,000 for a simpler case versus 35,000 for someone who becomes septic afterwards, right? Or preventing one severe sepsis admission is anywhere from 14,000 to up to $81,000. So there's a huge cost savings opportunity if you are able to diagnose this earlier and start treatment earlier, so your patient can avoid those complications and admissions. Preventing one ER visit is around $2,000. And here, the specific use case would be someone that you're sending to the ER to rule out a DVT. This is such a perfect case to manage in an outpatient setting if you have the right tools in hand, right? So if you have POCUS, you can perform a point of care ultrasound on the patient to look for blood clot and avoid this ED visit for this patient. A very clear use case there. Preventing one ruptured AAA, $28,000 to $43,000, and obviously huge for the patient. So This is more geared towards primary care physicians who are doing some screening um, aorta exams in their office, for example. And once again, to get billed for those, to be able to bill for those need to be clinically indicated. For example, if you are doing a screening AAA ultrasound, those should be really on smokers who are over 65. Typically, they need to be male patients. However, if you're doing it for diagnostic purposes, an older patient who comes in with abdominal discomfort, it's a total fair game to look for AAA with POCUS. And finally, I wanted to touch on this cost avoidance opportunity. And here I'm talking mostly to the urgent care urgent care group. This is actually an example of a rib fracture. And you can see very clearly discontinuation of the cortex of the bone here, demonstrating a non-displaced rib fracture. This is how good ultrasound is at finding fractures, especially of the long bones. And it is actually comparable to x-rays in a lot of instances. There's also a lot of good literature on ultrasound being a better modality for lung pathology. So if you're looking for pneumonia, pneumothorax, um, CHF exacerbations like fluid overload, pleural effusions, ultrasound actually has better sensitivity for those specific indications. So I just wanted to make a point here that because a lot of urgent cares are experiencing shortages of radiology techs, and a lot of more rural practices are experiencing the same. So they are facing to either needing to cross-train their providers in the states where they can and their MAs to perform limited scope x-rays, or they need to pay premium prices to retain their radiology technologists to perform the x-rays. So there's an opportunity cost avoidance of approximately $120,000 per year if if you are one of those clinics that has very low volumes of x-rays to begin with, and you're spending uh, premium pricing to get your x-ray techs to be able to staff them and to guarantee that they are going to be there every day of the week for your patients. And this also takes in consideration the maintenance of the x-ray equipment as well. I feel like I've been talking a ton. We have a question for you guys, and that's a poll on just seeing how many of you are experiencing x-ray tech shortages. And maybe this doesn't apply at all to you. So we got one answer, 100% staffed, great. 50% staffed, not applicable, okay. So it seems like it's a bit variable. We got kind of like half and half. People are saying they're staffed fully, half at 50%. Okay. Yeah, you can share the results with everyone. All right. Well, I'm going to move on. And I think for those of you who are experience that 50% staffed a situation, this is a good place to kind of consider POCUS. What can POCUS do for you where maybe you can reduce your x-ray uh, expenditure, or maybe you could have a kind of if you have a few sites that are next to each other, only one of them would have x-ray available, and the rest might have something more cost effective available for the patients. So a lot of people ask, well, what does it take to introduce point of care ultrasound in their clinic? How much does the equipment cost? What about the storage, the archiving of images, the documentation, the training for the providers, etc. So I put this together kind of more as a bit of a cheat sheet for you all. This is considering one clinic that's purchasing one handheld device, training 3 providers in 4 point of care ultrasound applications, And part of the training for those providers would be also reviewing their images for quality and also to make sure that they meet the guidelines, the credentialing standards that exist from ASAP, from AFP, from other medical organizations. So all of that, so purchasing a device, having some kind of archiving tool or maybe cloud storage, training convention with those providers. So the starting costs are an investment of around $20,000. Of course, it depends on what type of device you end up purchasing. If you decide to go with non-handheld device, those can be costing, starting at $20,000. So this is just having being really cost conscious and starting at a lower price point. But this is the amount you're looking for. And I think making this investment to then be able to provide more informed patient care, hopefully avoid some ER visits, and also have direct revenue from direct billing is can really offset that startup cost for you. And I was just kind of looking also for you presenting this over the years. So if this one clinic starts at $20,000 on a year or two, the investment might be really small, depending. You might require some CME, for example, virtual CME for your providers, maybe some ongoing QA. That's QAing only 5 to 10% of the scans. You might choose to do some hands-on refresher workshops as well. That's why the cost is so varied. And to put this in perspective, I call this slide "small investment, big impact" because the impact is real, right? So if you're performing 10 exams a week, that's an opportunity for direct billing from $25,000 to $90,000 based on those CMS fees. The cost saving opportunity, avoiding one high cost admission, is $960,000, almost $1 million of cost savings potentially. And then also the cost avoidance piece, right? So if you are in that situation where you are struggling to staff your x-rays, if you are underutilizing them, POCUS might be a better solution for you. And I did mention earlier about the indirect financial impact of POCUS. So consider those things too, right? So the patient experience component is a big one. Wanted to share with you also, this is available on the website for the download. We'll share a link, but we do have a POCUS billing readiness checklist. This is something for you to consider if you're thinking of rolling out POCUS, or maybe you are using POCUS, but you want to kind of get to a higher standard and higher compliance with point of care ultrasound for billing purposes. So a few things to consider. First of all, start with the POCUS CPT codes. Are they in your payer contracts? If not, definitely negotiate or carve out to include those CPT codes, and also negotiate rates. If you are in flat fee contracts, there is a way to negotiate carve outs to be able to bill for POCUS separately. Definitely credential your providers. So Hello Sono doesn't credential providers, but we do help support with that process, offer support with this process. So that means training the providers, make sure they're getting feedback on their scans, so they are really proficient, and then they are meeting the standards that currently exist for credentialing. And it's important to maintain documentation of the training. You want to store images securely and indefinitely. So it needs to be HIPAA compliant. You need to have long-term retention. If there are audits, this could be cloud-based. This could be sitting on your server in a folder. This could be a third-party solution that allows for viewing of the images. But all of that needs to take place. And you also want to document POCUS appropriately. Make sure that there is a separate procedure note that shows the indication, the findings, the final interpretation, also what the timestamp or when it was performed and by whom, and also document in your MDM section the medical necessity component. You want to have a quality assurance process in place for your POCUS program. In general, it is recommended to review 5 to 10% of POCUS exams for credentialed providers. You also want to have some monthly logs showing that you are keeping an eye on your POCUS program and there's proper QA being performed. And this is not just good practice in terms of clinical perspective, right? So we want to provide the best possible medicine for our patients, but this is also in case of audits, right? If your payer comes to you and asks you for proof of training, for proof of QA, you should be able uh, to pull those documents easily. And finally, coding and billing correctly. Yes, very, very important. Make sure you're using correct CPT codes, use modifiers if needed. And you can also use POCUS to determine your E&M level complexity, right? So for the flat fee contracts. So remember, there's also an opportunity there. So the big takeaways for today is I believe that POCUS has multiple financial wins. And if you put those together with a clinical impact, I think this is a really amazing tool to have at your disposal in your clinics. Documentation and training are essential for billing success. And I would say one of the greatest benefit of bringing in POCUS in terms of that cost avoidance that we talked about is for clinics who have low X-ray volumes and they are struggling to staff their X-rays to begin with. POCUS would be a really great choice. Before we take the Q&A, I did have a quick announcement that we have a webinar coming up on August 25th. This one is actually a clinical webinar. And this is a QR code. We'll drop a link in a chat. You can also find it under our events page on hellosono.com. But we will be talking about how you can use POCUS clinically for gallbladder evaluation, how it can make an impact, what are you looking for, etc. And this is our kind of all-in-one place QR code where you can look at all of our resources, upcoming events, etc.